Hey everybody, it's Dr. Justin here at Fulk Chiropractic for another episode of Doc Talk. So a couple weeks ago, I went through a 5-part series on low back pain, different radiating patterns into the legs and disc problems, facet problems, and all those different things. We see those on a real regular basis. One thing that those are often confused with is sciatica. Sciatica is a really common word. It is a common condition, but not near as common as people think it is. Most people, or a lot of people, I guess, think that if they have pain in their lower back, they've got sciatica. So the sciatic nerve doesn't start in the lower back necessarily. The sciatic nerve starts after you have the nerve roots that come out of the lower back, and they all combine and form the lumbosacral plexus. So then all those nerve roots come into this plexus, and then they split up and they combine with each other. And then after they split up, they form the actual nerves that go down to the legs. One of those nerves is the sciatic nerve. So it doesn't start until the mid-buttock area. So if you come in with a low back pain and that's your only symptom, it's not going to be a sciatica symptoms. So that's just one common misconception. So sciatica, it varies person to person, but typically you're going to get pain in the buttock, down kind of the back to side of the thigh, and it's going to sometimes wrap around the knee, down into the calf, and a lot of times we see numbness in the foot. It does vary by person, depends on what nerve fibers are being affected. But that's the real common stuff. The cause, lower back problems, hip problems, dropped arches in the feet is a real common one too, because anything that changes the function of the hip and the musculature in the hip to affect the sciatic nerve can cause those symptoms. Treatment options. So along with the causes, we try to fix the causes, fix the causes of the actual problems. Chiropractic adjustments, getting the function returned to the spine, to the pelvis, to the hip, knee, and ankle. Electrical acupuncture is something we do a lot. So we do needle acupuncture in the area, in the buttock area, around what's called the piriformis muscle. A spasm of the piriformis muscle, which is it's a rotator muscle of the hip. When it spasms, it can put pressure on the sciatic nerve, and that's the most common cause that we see of sciatica. So what we do is put needles around that area and hook electrical impulses into it, and it kind of massages the piriformis muscle and gets it to relax. And so that's really effective for it. If the problem is the arches in the feet are dropping, you've got to support the arches, or else you're never going to have any long-term benefit from treatment. So a combination of things, just depending on the case. Expectations, we typically see pretty good improvement within a couple of weeks of care. Seeing something 2 to 3 times a week for a couple of weeks, we're seeing some pretty good improvement in most cases. So again, it's a common condition, but not every leg pain or back pain is sciatica. So there's a bit of a difference with it. So if you have any questions, just let us know. And until next time, stay healthy.